This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what is gymnast wrist. If you like this video, we put out new content weekly, so please like and subscribe. So gymnast wrist, basically what it is that there's the growth plate at the end of your radius bone, and that growth plate has gotten irritated from repeated stress, like gymnasts going on their hands essentially. And what that will manifest as a gymnast, usually who's not fully mature, having pain kind of at the end of their wrist. And they'll probably notice it while they're doing gymnastics or any activity where they have to lean on their wrist. And it's not really like they're pointing at their wrist, they're kind of pointing a little bit further back. So how can you tell if that's the diagnosis? You can get x-rays and you might see the growth plates a little bit wide. Again, there has to be a growth plate. So if they're skeletally mature, this is not something that they get. You might, like again, so on x-rays you might see the growth plate a little bit wide, or if you get an MRI you'll see lots of edema or fluid around the growth plate. The good thing is that this usually goes away, but the bad news is that you might have to stop doing gymnastics for about 3 to 6 weeks until the pain goes away, and rest it and take anti-inflammatories. Surgery is very rare, and that's only if the growth plate's been damaged and part of it's fused, and so you might have to excise that. Or if the whole thing's damaged and fused, then it's a complex reconstruction where you have to fuse the other bones so the wrist doesn't grow funny, and like maybe take out some pieces of bone to make the wrist proper. But by far and away, it's just the growth plate's a little irritated of the distal radius or the end of the radius bone from getting pounded. You stop pounding it for a while, it usually goes away. So I hope I was able to answer all your questions about what gymnast wrist is. If you like this video, we put out new content weekly, so please like and subscribe. If you have any medical questions I didn't answer, please leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only.